Hello, my name is Sarah Warren, and I will be presenting on electronic charting and prescribing. My first part that I want to talk about is patient safety. In the case study provided, there was a medication error because a patient was supposed to get one medication and it was abbreviated and misunderstood, and it resulted in patient harm. I wanted to talk about how medication errors are known to decrease with the proper utilization of electronic prescribing. The baseline rate of errors in prescription that is handwritten or given via the telephone is 42.5% of prescriptions containing some sort of error, and that can decrease down to 6.6% when you properly utilize an electronic prescription. So we want to talk about how access to a drug allergy list, drug to drug interaction list, we can assess for duplicate therapies, and we can get dosing recommendations based off of an updated patient weight. All of those can contribute to decreasing the rate of very expensive medication errors in healthcare, and it can also improve patient safety. Let's talk about the cost and the benefit of an EMR. So the one that I chose is ChartLogic EMR. It offers electronic prescribing. It is CMS certified, so it's certified under the Center for Medicare and Medicaid. It can help us give televisits. It has a patient portal, so patients can contact us with really brief, basic questions and input. And we can also talk about they have customizable templates so we can cater this system to our specific practice. This is going to decrease costs for patients, particularly in their prescriptions. So, when we utilize this EMR, we can understand what their formulary options are based on their insurance policy and choose from that list first. Hopefully, this will decrease prescription costs for patients, and there, we can also talk about how it will decrease the rate of medication errors, which, as stated before, will help with those costs associated with medication errors. The cost of the system itself is $350 per month per provider, which has been about the median of what I was researching. So this should be appropriate for our practice. My plan for integration, some parts that were marketed on the EMR's website is that it has an IT service desk support that's open 24/7. There is an option for on-site assistance during the first week of implementation that does come at an additional cost that I was not able to find, but it might be a good idea for our practice. And then we can utilize their program and instructional videos. So I want to make a list of everybody's daily functions. So that's going to be depending on their role, checking in a patient, sending a portal message, checking and sending prescriptions to a pharmacy, ordering labs, updating billing information, etc. We want to make sure that all of our staff can practice these functions that they're going to need to do on a daily basis in their in their demonstration software. And due to the fact that our case example is transitioning from paper charts to electronic charts, there might be a time barrier of people needing to manually scan in old lab results, old progress notes, so that it's all in our EMR. So that's going to be a long time commitment. We might need to break it down and say, okay, everything done in the past year or in the past 5 years needs to be scanned into our system or plugged into this new electronic system. And that's going to be a time crunch. So once staff members can successfully perform these functions in the demonstration, I would recommend having an on-site technician during the first week so that patient care is not impacted during this transition time. So evaluation, how do we know if this software is doing what we want it to do? We can look at the rate of medication errors in our system 6 months to 1 year after implementation. We can ask for provider and staff feedback, make sure that there's no issues with the software that we can't troubleshoot with their IT. And we can look at patient compliance of medications as briefly stated. We can talk about how we can offer formulary options first. And with that, hopefully, medication costs will go down for our patients. And therefore, we would hope to increase compliant use of those medications that were prescribed. We also want to look at productivity tracking. We want to make sure that the time to discharge a patient, the time to administer medications is similar, if not decreased, due to our EMR system. We don't want it to increase workflow disruptions. ChartLogic's website claims that it minimizes the disruptions, so we can track that as well. Right. And now we need to talk about policy updates. I would say that this is going to be one of the larger goals in terms of this transition. One potential challenge of transitioning from paper charting to electronic charting is going to be prescriber compliance, especially for these older doctors or older prescribers that aren't used to an EMR system. It's going to be important to emphasize that all prescriptions need to be documented in this EMR. Otherwise, the provider A might send a prescription for an antibiotic, but provider B also sent it in the EMR because they didn't see that Dr. A already did this. So it's going to be important in terms of duplication or lost orders. And then we're also going to review our HIPAA guidelines here. One example that I really like to bring up, it was published in the Missouri State of Nursing newsletter where multiple nurses were terminated for accessing the chart of a celebrity that was treated at their care facility for multiple days. And that is obviously a HIPAA violation. You should not look into anybody's chart, paper or electronic, unless there's a medical need for you to do so. Other examples of potential HIPAA violations that are increased risks due to an electronic chart is looking up a friend or family member's chart, having a web page open and then getting distracted and need to walk away from your computer. Now another patient can look at that computer screen and see all of that information. So making sure we're logging out of our web page before we walk away and perform a different task. We also want to make sure that we're not sharing passcodes with peers to also help with privacy. So it's going to be important to educate staff and remind staff of these roles and responsibilities. And while an EMR is a really useful tool in preventing medication errors, it does not make us immune to administration mistakes. So we also want to make sure that our staff is aware that it is still their responsibility to check the right dose, the right route, the right patient, check their allergies, the right time for administration, and the coverage. If it's an outpatient facility specifically, we need to make sure a prior authorization is collected before the administration of any really expensive medications that could increase the cost of our from our facility. Lastly, I want to talk about sustainability. To ensure that this EMR is successful, it is important to review internet availability. Most of the time, this is not an issue in the United States, but in rural areas or if it's outside of the United States, war-torn places such as Gaza, internet access may be impeded. So we want to make sure that in the event that we lose internet access, can we still have any sort of backup in terms of patient data? It is also important to make staff aware of any updates to the software as they happen. We can review monthly costs to ensure maximum financial benefit, make sure that we wouldn't get a better deal with a different EMR, maybe check that every 6 months to a year. And then legislature has greatly impacted how we chart and how we practice our medicine. So we need to make sure that we're staying up to date in terms of bills that are passed. A great example of how this really changed us was the Health Information Technology for Economic and Clinical Health High Tech Act. Gave a lot of Medicare and Medicaid reimbursement because if we were transitioning to an electronic charting system. So making sure that we're staying up to date on local legislation as well as AI. It sounds kind of scary, but there's been a lot of talk since 2021 about how artificial intelligence is going to impact healthcare in general, specifically our charting. So making sure that we are being compliant with this and staying up to date in terms of our options and how we can optimize care for our patients. I provided in-text citations for all of my data, but this is also my reference list. If you would care to check that, thank you very much, and I hope you have a great rest of your day.